Good afternoon, everyone. I'm Dr. Nishitosh Niranjan, practicing pediatrician at Greater Noida. I run a child constipation clinic, which is one of a unique concept in complete North India. Presently, I'm having 130 children with chronic constipation under my observation. So today, I'm here to discuss a interesting case of a 4-year-old child, Ridraj, who is under my observation and resident of Greater Noida. He's 4 years of age, 15 kgs of weight. He presented me with a complaint of not passing stools for 3 to 4 days, and from last almost 2 years child was passing stools only during the school time, and it was uh, like a fecal swelling, and child could pass stools only after giving the suppository after 3-4 days by the parents. Behaviorally, child was very irritated. Child was having withholding behaviors. Parents visited multiple pediatricians in last 2 years. Sometimes laxatives was given for a short period of time. Sometimes this episode was swelling episode was misdiagnosed as loose motions. Child has been given antibiotics. Child has been given antiparasitic drugs, but of no use. When child visited to me, I have gone through a thorough history taking, and a clinical examination was done by me. On clinical examination, I found that child was having fecal loading on the left iliac fossa, with typically hard mass was palpable over there, and which was confirmed by X-ray abdomen erect, which shows lots of fecal impaction and fecal loading in the left colon, descending colon. So as child was having history from last 2 years of not passing stools daily. Child was swelling pants during the school timing. Child was very irritable. Child was having withholding behaviors for stools. Child has been visiting multiple pediatricians and changing pediatricians with ineffective treatment. Child has been diagnosed with sometimes acute constipation, sometimes diarrhea, sometimes parasitic infections, but of no use. So I started my diagnosis with coronal functional constipation as per the room 4 criteria, with fecal loading and disimpaction. So on management part, I started with a disimpaction phase with polyethylene glycol 4000, that is PEC 4000 in syrup form. So I disimpacted the child on OPD basis, and I have given 30 grams of PEG, that is 75 ml of PEG 4000 in 2 divided doses, morning and evening. Initially, child did not pass stool for next 2 days, but after 2 days, PEG effect was visible, and child was started to pass stools after 3 days, and after 4 to 5 days, child was passing multiple times of stools with milkshake like consistency. And after 5 days, when I examined the child was having soft abdomen without any fecal loading. So first phase was completed, that is a disimpaction phase. After disimpaction phase, I shifted that child to maintenance therapy. So I've as the child was 15 kg, I started polyethylene glycol 4000 at 15 grams daily at bedtime dose for next 6 months. After initiating the maintenance phase, child was passing stools initially every second day, and after 45 days, child was able to achieve daily soft stress-free defecation. And after 2 months, the complaint of fecal swelling in the underwears was stopped. and maintenance therapy was continued with polyethylene glycol 4000 for 6 months. Before initiation of the third phase, that is a tapering phase, I have made sure that child is stress free, passing motions daily, and the child was not soiling underpants. So as per the history, child was having no difficulty in passing daily motions for 4 months. Diet counseling has been provided to the patient, and child has been in a very good diet with restrictive of milk, high fiber intakes. Daily fruits were given to the child by the parents, and appetite was significantly improved, and child has gained almost 2 kgs of weight after 6 months. So now his weight was around 17 kgs. So after considering all the fact, I thought that child has been cured well, and now he can be shifted to tapering phase. So I tapered polyethylene glycol 4000 very slowly over a period of 4 months. So initially it was 35 ml OD, then I shifted to 25 ml OD, and then 15 ml OD. Then I stopped the treatment. After stopping the treatment, after almost 9 to 10 months of the whole therapy with polyethylene glycol, I was successfully able to stop the therapy, and child was passing stress-free motions on a regular basis. Presently, child is under my observation, and the follow-ups visit are done every 3 months, so that everything counseling is done on a regular basis, and enforce the uh, good dietary habits, good quantity of water intake, and physical activities, going to toilet uh, every morning daily before school for the enforcement purpose. So this was a interesting case which I would like to share with you all. So thanks a lot listening to me.